Do you have questions on how to properly care for your pet? When is the right time to get your pet spayed or neutered? Or maybe you're looking for a place for your pet to stay while you go on vacation. Mapleview Animal Hospital. Dr. Bader from Mapleview Animal Hospital gives you great advice for your pets. Mapleview Animal Hospital on Panther Drive at the corner of Riley and 136th on Holland's North Side. And on the web at mapleview.animalhospital.net. Mapleview Animal Hospital. They love your pet like you do.
1450 WHTC, Holland's news leader.
Here's Sarah Donkersloot.
Thanks, Juke, and Happy New Year, Juke.
Thank you very much.
And welcome to Wellspring, a live broadcast sponsored by Spectrum Health-Zeeland Community Hospital. My guest this morning is Zeeland Community Hospital President Henry Veenstra. This morning, he's going to look back at 2014 and also talk about what he foresees for the hospital in 2015. Good morning, Henry.
Good morning,
and
Sarah.
This is an annual thing for us, isn't it?
It is. I get to visit Juke and see him every year. And
it was neat because when I looked at your schedule, I said, Henry, it's time for us to think about Wellspring. And he said, I want that first Thursday of the year.
That's good. That's good.
And he opened up his schedule. So we are really glad that you're here.
Well, I'm thrilled to be here, and of course, as you know, I like to talk about what's happening at Zeeland Hospital.
And the first thing I want to ask you, it's been 4 years since the integration with Spectrum Health. How is the integration benefiting patients?
Well, we have now, as you said, been part of the Spectrum Health system for 4 years as of January 1. Spectrum Health brings us a depth of expertise that we never had as an independent hospital. And somebody asked me recently about that, and I said, for example, in the recent Ebola incidents, with the system, with the infectious disease specialist, we had at our fingertips all the things we would have to do. Even though there is a slim chance we would ever encounter an Ebola patient in Zeeland, we had the expertise available to us if that happened. And that's just one example. In addition, as we look ahead, we're going to be expanding our breast cancer service, our specialty care service, and we can work with the specialists at the Regional Cancer Center at Lemon Holton Cancer Pavilion downtown to get the expertise to let us know what we have to do to provide the best care possible for breast cancer patients, for colon cancer patients. So this gives us that depth of expertise we didn't have before.
What about for patients? Are they benefiting from services?
Obviously, with then the expertise and the access for referrals that we have through the system, we can assure our patients that the level of care that they get in Zeeland is equivalent or better than any place else. And we have for our staff the expertise. We've had a width of expertise, but now we have a depth of expertise that allows us to care for patients, to access our patients in a way that we didn't have before.
So some things that happened in 2014 that benefited the community.
Well, we had a lot of good things happen in 2014. Our bariatric surgery program for patients with weight problems that have to have surgery to correct it not only expanded but was recertified or recredited. We have mobile MRI services, which is magnetic resonance imaging, and we added days of service there. We added an OBGYN specialist, so our women's health and our family birth center is expanding. Number of orthopedic cases has increased. We do more knee and hip replacements now than ever before, and we have a great relationship with Shoreline Orthopedics. We've added a pediatric hospitalist, Dr. Paul Spilatro. So
I'm going to interrupt you a second. What's the benefit of a hospitalist for patients?
A hospitalist is a physician who is specialized in taking care of patients in the hospital. So he knows the diagnostic procedures. He knows how to get patients admitted into the hospital in the inpatient setting. He works with the patient's primary care physician to ensure that all of their needs are met, and they're there physically located in the hospital at all times. In the past, we had physicians who were seeing patients in their office. They would get calls about, okay, your patient in the hospital has a lab test that's abnormal. Now the hospitalist is actually there. focused only on inpatients while they're there and physically located.
And it's very unique to have a pediatric hospitalist, isn't it?
Right, for a community hospital especially, and we feel privileged to have Dr. Spilotro so that he can take care of all the newborns, he can take care of the pediatric patients that come in. He, again, can work with the office-based pediatricians to ensure that when their patients are in the hospital, that he is in communication with them to make sure that long-term the pediatric patients have the best care.
I know the hospital has a sleep lab. Any growth in that in 2014?
We found the demand for sleep studies was so great in this area that we expanded the number of nights and the number of actually beds that we have to do sleep studies. But the exciting thing for us is we're now working with Helen DeVos Children's Hospital, and we're going to be able to do pediatric sleep studies as well as adult sleep studies. And this will alleviate the need for parents to drive into Grand Rapids to have this study done, and they can have it right here in their own community.